Did you know that brushing alone is not enough? Even if you brush with a high-end electric toothbrush, you still need to floss in order to obtain optimal oral health results. And Waterpik Water Flosser technology makes it easier and more effective than ever. In fact, there are a number of clinical studies proving that, regardless of what toothbrush you use, adding a Waterpik Water Flosser will significantly provide better results.
Brushing alone is not enough because the bacteria can linger in between the tooth and the gums where the bristles can't reach.
Brushing leaves behind bacteria and plaque biofilm that a toothbrush can't physically access. And that plaque biofilm will lead to periodontal issues eventually in a patient. So they do need to do more than just brush.
In order to test the impact of adding a Waterpik Water Flosser to a high-end power toothbrush, a recent 28-day clinical study was conducted. Subjects were instructed to brush with an Oral-B Pro 2000 electric toothbrush and floss with a Waterpik Water Flosser to compare the results of brushing with the Oral-B toothbrush alone, and the results were dramatic. The group that used the Waterpik Water Flosser had significantly better results. 33% more effective for plaque removal, 36% more effective for gingival inflammation, and 37% more effective for gingival bleeding. Thus, while Oral-B Pro 2000 is a highly effective toothbrush, this study confirms that adding a Waterpik Water Flosser to an already effective brushing regimen can deliver a significant improvement in your patient's oral health. In another clinical study, brushing with an ADA standard toothbrush was compared to brushing and flossing with a Waterpik Water Flosser. And again, the Waterpik Water Flosser group showed a significant improvement in all clinical measures taken. 2.4 times as effective for plaque removal, 2.7 times as effective for gingival inflammation, and 3.1 times as effective for gingival bleeding. These studies, all published in peer-reviewed journals, show conclusively that regardless of what type of toothbrush your patients are using, manual or electric, adding a Waterpik Water Flosser to their regimen will dramatically improve their overall oral health. These studies are part of a large body of research that consistently show the Waterpik Water Flosser to be a safe and effective means of flossing. And best of all, water flossing is easy and your patients will get healthier gums in just minutes a day, a real plus for patient compliance. This demonstration of an ear of corn helps to show why water flossing is so effective. The Waterpik Water Flosser thoroughly removes all the debris within seconds.
Water flossers are much more effective than traditional floss, and again, it comes back to the compliance of the patient. If you can recommend something that the patient's going to easily implement in their everyday practice, you're going to have a healthier patient overall.
Here at Waterpik, we are always striving to make it easier to achieve superior flossing results with innovative new products, including Waterpik's Implant Denture Tip. As you know, it's difficult to clean under implants in between visits. The Implant Denture Tip makes it easier than ever and reduces the risk of peri-implantitis. And now, oral care just got even better with Waterpik Sonic Fusion 2.0. Now you can brush and floss at the same time with 2 times the bristle speed, plus superior flossing power and a quieter brushing experience versus the original Sonic Fusion. The Waterpik Sonic Fusion cleans deep in between teeth and below the gum line. It's clinically proven up to 2 times as effective as regular brushing and flossing for removing plaque and improving gingival health. Waterpik Sonic Fusion makes it easy for your patients to floss every time they brush. You can clearly see Sonic Fusion delivers deep interproximal penetration for better oral health. Now your patients can have cleaner teeth, healthier gums, and better dental checkups. Waterpik has a full line of products, all delivering superior clinical efficacy and improved patient compliance. Aquarius Professional, Cordless Advanced, Whitening, Ion, and Sonic Fusion.
My alternative to string flossing would be Waterpik Water Flossing. It's an easy, effective tool that appeals to the vast majority of our patients. Your non-compliant flossers, perio patients, implant patients, orthodontic patients, and it simplifies their oral care in one tool. It eliminates having string floss rubber tip stimulators and interdental brushes.
Water flossing is the most effective way to remove bacteria inoproximally. Patients really are looking for the science behind the product and making sure it works. It's not just a hype advertisement. And I'm seeing the results clinically.
Brushing is not enough. The Waterpik Water Flosser works, improves compliance, and is clinically proven in study after study. Waterpik, the easy and most effective way to floss.